The U.S. population is older than it's ever been. We baby boomers are living longer, and there are currently more than 55 million Americans over the age of 65. So here's the issue. There is only one doctor for every 10,000 older Americans, according to the stats we've been looking at. So we've asked Dr. Molly Ehlman, she's with Mercy Hospital, to join us this morning, where they're trying to solve this shortage with a new program. Good morning. Thanks so much for coming in.
Thanks for having me.
So you call this program 65 Prime Plus. You have these clinics. How does this help?
Yeah, so older adult patients definitely have different medical needs than younger patients. They're more likely to have chronic medical conditions like diabetes, high blood pressure, heart failure, kidney disease. Also more likely to suffer from common geriatric syndromes like falls, memory impairment, urinary incontinence, polypharmacy, which is the prescription of multiple meds at once. We see this a lot in our older patients. They're also more likely to have hearing trouble, vision trouble, and that can really impact their function.
Absolutely.
So these things taken together mean that older adults really benefit from a specialized level of care.
And this is your specialization.
That's correct.
How many patients do you have overall, do you think?
Yeah, so our clinic, 65 Prime Plus by Mercy, one of the great things about our primary care model is that we have smaller patient panels. So this allows us to provide extended visit times with our patients. We can spend more time with them, getting to know them, not only just get to know their medical conditions, but also really important things about their function, who helps take care of them at home, how are they getting around, what matters to them, when time is limited, how do they want to spend their days. These are all really important conversations that need to happen with enough time and can't be rushed in a 15-minute office visit.
So let's say you're older, you have your own primary care doctor, and they retire, and you need to. Can anybody get into this? I mean, is it difficult?
Yeah, so our clinics see patients that are 65 years and older who have Medicare or Medicare Advantage plans.
Okay.
So there's no extra associated cost. So we're taking patients who have chronic medical needs, who want a higher level of specialized care for older adults.
Yeah, so is this increasing? Are you seeing on a daily basis or a weekly basis more people hearing about this and coming in?
Yes, exactly. There's a really high demand for this specialized level of care, and by giving our patients longer visit times, more time with their doctor, great access to care so we can get patients in quickly when they need to be seen and prevent unnecessary ER visits, emergency or urgent care visits, keep them out of the hospital by giving them the care that they need when they need it. That's all part of our model.
You like being a geriatrician, I can tell.
I love it.
Yeah, and you chose this from the start. You didn't just fall into it. If we have any young people watching or parents who say, my kids want to go into medicine, what would you tell them to go into this field? Why would they enjoy it and find it fulfilling?
Yeah, it's so rewarding to work with older patients. They're so wise. They have so much to offer, and medically they're very complex. So every day is like solving a puzzle. It's been a really rewarding career choice. Excellent.
Well, if you want to get more information on these Prime clinics, 65 Prime clinics, just contact Mercy. Is there a special number?
Yeah, so you can go to mercy.net and search for 65 Prime Plus. We have several clinics open now today, and we're opening more across the region in 2025.
Dr. Molly Ehlman, thanks so much for coming in.
Thank you.
Some useful information there. We're going to take a little break, and we'll be back with more Fox 2 News in the morning at 7 right after this.
I don't recognize this world. I don't remember.